Hi there, my name's Tim and this is my wife. We are both volunteers for NHS Trust at Airedale, doing a real-time patient survey. What we do is go around with this computer asking patients that's been discharged what their experience was in Airedale Hospital, whether they've been in for a day, a week, and it gives back to management an actual real-time survey of what the patient's experienced.
From that they can use that to make improvements. It goes back to the sisters or charge nurses on the wards, and they can make improvements if there are need for that.
And we come and introduce ourselves and say we're from the volunteer service from the hospital and we would like to ask you some questions about your stay. You've got to be able to relate to people and understand why they're here, and what we are trying to do is trying to give patients that come after them to make sure they have a good a stay as these patients that we're seeing today. We're both, I think, used to dealing with people in our past jobs. I would say they get a feeling that, yes, there is people that cares about them, not just the clinical care, but the well-being and the experience. Was it a good one? Was it a bad experience? And we must say at Airedale Hospital, most patients have a very fantastic experience. Because it's done on a daily basis by ourselves and other volunteers, that the chief nurse on a weekly basis knows exactly what the patients are thinking about this hospital without having to refer to paper sheets that some patients do eventually fill in. The hospital trust knows exactly what's going on in the hospital on a daily basis as regards patients, what they're thinking.
And also if they fill a paper sheet in later, you perhaps wouldn't answer the questions in the same way because the experience is over and you see it in a different light. Whereas when we come in, they're leaving today and anything that's gone wrong is fresh in their minds.
To give back to the community that I've lived in for years and years and years, and I've even worked here. So the funny thing is, I'm coming back on a voluntary basis because I enjoy it. And if I enjoy something, we both enjoy something, the people you meet enjoy things.
It becomes almost a social activity.
It becomes a social activity.
Not only that, if you get a bay of, say, 4 men or 4 ladies and they're all of the similar, shall we say, nature, oh, it can be bedlam, can't it? We're in hysterics with them. Breaks the monotony for them at times. Yeah. But no, it's interesting to come, isn't it? Because what age range is from, say, young people, 16, 17, 18, up to 99, just a half a day or a day a week, whichever. When you come here, you have to adhere to the hospital regulations about dress code, nothing below the elbow, and you've got to be neat and tidy appearance, and you have to attend mandatory training sessions. Do it.
Do it. Just come and do it.
There's all sorts you can do.
Besides what we do, there's the Friends of Airedale, there's New Venture shops, library, wheeling patients to church services. Even if you're working full time, there's things to do at weekend.
Do it.
Do it. Just come and do it.
There's all sorts you can do.